Okay, welcome then to this session on mastering APA PsycInfo in the new EBSCOhost interface. So you are looking at the APA database available on the EBSCOhost platform, and in particular, the new interface, which a number of you may have already migrated to over the past few months. Some of you are yet to migrate to it, but in any case, we'll see where the EBSCOhost platform is right now in terms of recent releases to the platform. So just to formally introduce myself, some of you may not met before, you may not have attended an online session with me. I've been with EBSCO now for 14 years. I'm a senior customer training specialist for EBSCO. I live in East Midlands in the UK. I'm a chartered librarian, having worked previously for 12 years or so in NHS library services in England in a variety of different roles. So my remit presently is to support yourselves in the UK, Ireland, and the Nordics. And I do believe we do have attendees from all those territories today, which is great. So thank you for joining this session this afternoon. Okay, in terms of what we plan to cover in this webinar, we'll look at navigating the new interface, so the navigation options, just to give you a reminder of what's there currently. A live demonstration of a lot of the key features, elements in the context of searching APA PsycInfo by a particular framework. So we'll look at basic advanced search options. We'll look at the use of the APA Thesaurus, which has been enhanced over the last few months. Also, the application of filters and limiters, whereby you can focus your search results, including those available directly on the EBSCOhost platform, also those supplied by the APA for this database, and also the tools whereby you can save, cite, retrieve records as well, and also provide you with the opportunity to ask questions at the end if you have any outstanding. So I may leave some of the questions till the end. So in terms of the actual objectives, I hope that by the end of this session, you'll be able to use the natural language search mode to find relevant records in answer to research questions. I'll say more about that before we run the live demonstration. You'll be able to create and run a PEO framework search on APA PsycInfo. So I'm sure most of you, or many of you, are familiar with PEO. So PEO is just an alternative that we can use for this particular example that we have today to run the search. Use the APA Thesaurus to identify relevant subject terms. So we'll do a combination of free text keyword searching with the use of the APA Thesaurus terms in our example. Also, the application of filters to refine search results effectively, and also utilize the EBSCOhost tools to manage and organize your research. So if you need to cite a record, you need to download a record, export a record, etc., we'll go through those steps through the session. We'll just have a quick introduction into the database itself for those who may be less familiar with the content and coverage of this database. So some of you may have used APA Psych articles, Psych Extra, Psych books. So we are looking at a particular database from the APA. So it is, of course, the world's largest resource devoted to peer-reviewed literature in behavioral science and mental health, produced, of course, by the American Psychological Association. So it's really an indispensable tool to find global scholarly research in these areas, in these fields. So it is updated twice weekly, so it has a lot of obviously primary literature, which is added frequently. Millions of cited references included, millions of records spanning 600 years of content, if you need to go that far back. And of course, it does index 2,400 peer-reviewed journals as well. So the content you'll find here is essentially peer-reviewed. And content not just from journal articles, but also book chapters and dissertations as well. So some further information here. I mentioned going back 600 years. So you're looking at the 17th, 18th centuries, with extensive coverage from the 19th century onwards, and authored and edited books and book chapters are also included, and dissertations from Dissertations Abstracts International, and publication which from more than 50 countries and published in 30 languages. So journals published in 30 languages. So it's really a global research database that is available on the EBSCOhost platform. The first thing we want to look at is the natural language search mode. So we will have a demonstration of this, but basically we have this new feature on the new platform, which allows researchers to search using everyday terminology. And that would be in the form of a question or a statement. So it really is streamlining information retrieval. It makes it easier, quicker to identify relevant content using everyday language. And it's kind of akin to using the tools like Siri, Gemini, Alexa that you're familiar with. Others are familiar nowadays with the application of AI and so on. So it is AI powered. And by that we mean there's a large language model, which is currently Claude Haiku, and it's prompted to respond to the query that you enter. So as I said, the stipulation for using natural language search, whether it's from the basic search screen or the advanced search screen, is that you enter your terms in the form of a question or statement, not just a general keyword search as it would normally be for basic or standard searching. So we'll go straight to the interface for this live demonstration before we get into a more in-depth search. So let me now switch screens here. I will go to my desktop, and in a moment you should see the advanced search page for APA PsycInfo on EBSCOhost. So just to outline then what we have here, you'll notice, of course, there's a lot of white space on the new interface, and that is deliberate. It's designed to reduce the cognitive load. It's designed to be in compliance with the latest accessibility guidelines for the likes of WCAG and others. So we have, of course, the standard advanced search page in terms of the 3 rows showing here. You can add more rows, by the way. As you can see here, you can add up to 12, in fact, in total. So you can enter queries line by line, the terms line by line. We have below the search boxes or adjacent to the search boxes, let's go there first, we have the drop-down menu for the field codes, okay, and we've recently added title or abstract field code, so you can now search simultaneously in either of those fields, okay, in with one row, rather than going to search title or abstract on different rows as you did previously. So that's now applied to the APA PsycInfo database. We also have the link to the basic search. You can go to the basic search screen, and we'll look at that in a moment when we run the natural language search, which is also available here up front, as it were, with the various links available also. In addition, we've got the PEO app as well. So some of you may have seen this on other sessions that I've run on Cinel Medline, for example. So this allows you to replicate the clinical framework in terms of entering your search terms, your keyword search terms, combining them, and running a search. You can construct the query through this app, through this guided search, that will then can run on the interface. So we may have time to look at that as we move on in the session. And then you'll notice the filters are here, the first tab. So the first of 3 tabs there. So you've got the options to limit your results. So when you're searching from this in this context, then you can apply the filters to the search itself. You have the publication date, for example, a publisher, and so on. So some of these are specific to APA PsycInfo, others are more generic and apply to EBSCOhost in general. Importantly are the search options as well. So before we get into natural language search, you'll see the default search for APA PsycInfo is the proximity search mode. So proximity search mode by default would search for words as they appear near 5 words or less. So in other words, and in any order. So if you were to put in bipolar disorder, it look for the word bipolar before disorder and vice versa within a specified word range. Okay, that can be reconfigured in our EBSCO Experience Manager admin tool. So you can relabel this. It could be phrase, for example, as they've done in England in the National Health Service. It could be changed in terms of the default precision operator, which, as I said, is near 5 or N5. If you want more information on these search modes, for example, find all my search terms, insert the AND operator, which is typically used for our discovery service. Find any relates to the OR operator. Smart text searching is basically allowing you to cut and paste a paragraph or an abstract in the search box and to run the query against the key terms there. So you need to select that option. And natural language search mode, we'll come to that in a moment. But if you want any information on these search modes, please use the context-sensitive help menu for EBSCO Connect. It'll take you directly to the help screen, and it will give you, again, a review of each of those modes so you can determine what is best for your users. Okay, as I said, majority of accounts will default to proximity, can be relabeled, and the configuration can be changed in terms of the precision operator that's used. And some of these can also be hidden in our admin tool. So again, if they're not applicable or not usable for yourselves, then you can just hide these as well if necessary. Below that, we have the expanders. Again, this is something which we often cover in other sessions too. So priority words will bring back results based on the thesaurus terms that relate to your keyword search. So identifying the by way of a synonym within the thesaurus. Also search within the full text, does what it says. It searches beyond the citation, searches keywords for keywords within the document itself. And apply current subjects, which is on here by default, as it is in some a lot of accounts, will take your search term, map it to a key concept, and that in turn will retrieve relevant records based on the indexing that relate to that concept, as it were. So again, I would refer you to the EBSCO Connect help page for more information on those features. And then we have the subjects, the APA Thesaurus, which we'll also use today in this session. So I'll come to some of the other features, particularly on the dashboard a bit later, but just to begin then, we'll go back to the standard search screen, the basic search screen, and we'll look at natural language search. So if I just switch this on here, it's off by default, as you can see, and I can enter a query. So if we're looking at exercise therapy versus antidepressants in terms of reducing depression in patients, then we can enter the query in this fashion. So is exercise more effective than antidepressants for reducing depression in middle-aged patients? Okay, so that's the question we've got, and we're going to run that here in the natural language search mode. So if I click search here, it will generate the results below, as you would expect on this page in a moment. Okay, so you've got results below. So it's obviously refined it quite quickly. And you can see we've got the key terms are highlighted in yellow. Okay, so you can see the various terms there highlighted. And also in each of these records as well, you'll find there are the other terms, the key terms are also in bold in the abstract or in the subject fields as well. Okay, so you see the records there displayed. Okay. Now, you may be curious as to how is this searching? What does the query look like behind the scenes? There is an option here, show refined query. So it does show us explicitly how it's searched. And you can see this building query with exercise or physical activity or workout combined with depression or depressive symptoms and middle-aged or midlife, etc. Okay, so you could literally, copy that and paste it back in or edit it, etc. if you wish to. Okay. So you can see there's also this little link here. How does it work? It just gives you some random examples, which are not necessarily related to behavioral science or mental health, but giving users a basic idea as to how you'd use this particular feature. Okay. So again, it's in the form of a statement or a question. And of course, on here, we have various ways to display the results here. For example, I can see 50 here. I can change by the most recent as well, as opposed to the most relevant or the oldest. And in addition, there are filters here that you can apply to this search. As I said, majority of records within APA PsycInfo are peer reviewed, but if you want to limit this to a particular time frame, for example, the past 5 years, you can select that option. And likewise, you can specify the kind of content coverage that you want. Are you looking at, and see 150? So these are published in the last 5 years, etc. And then the source type. So you've got 5 dissertations, but you may want to focus on the academic journals here. So you can apply that filter. So you can run the query. And then generate the results. You can see the particular query, what's been generated, and you can also review the results displayed. So that's kind of more a basic search, but using the natural language search mode. If we click on new search here, by the way, you'll see under search options, that mode is also available here. So it's possible to run the natural language search on this advanced search page as well by just selecting natural language search as the default search mode as well. Okay. So again, it depends on what the landing page is for your users. Probably for most of you, most accounts, and that's certainly true in healthcare with the NHS or the HSC in Ireland, this is the default landing page for most users. But again, in an academic environment, you may have different profiles for different user groups. You may have, basic search or standard search for undergraduates, and then you may have the advanced search page for postgraduates, PhD students, and so on. So again, there may be different profiles configured for different user groups where you are. So that is just the initial introduction to the interface and also the natural language search. So what I'm going to do now is just go back briefly to the PowerPoint just to go through an example that we're going to be running live in a moment. So I'm going to share my screen once more. So we are looking at a specific question today for the PEO on APA PsycInfo, and that is, does social media use lead to eating disorders in young people? So this is our research question. We're going to apply this, identify the synonyms and then apply it to APA PsycInfo on this interface. So you can see already I've highlighted the key elements, the social media, eating disorders, and young people. So that will then lend it to the framework of using PEO, which is the population, patient or problem, the exposure, and then the outcomes. So we don't have an intervention as such here. In this example, it's more of the exposure. So we have young people who are exposed to social media, and we're looking at what is the impact of that in terms of eating disorders. So the outcome is the eating disorders and related symptoms, etc. So for population, we need to consider, what terms should we be searching for? What keywords can we be using? Because we have to consider what terms are normally used by researchers to identify this patient or population group. Well, we know there's young people, young. We could also say teenager or teen, adolescents as well, that age group. So all these are important terms, synonyms that we can use to identify using free text terms, content relevant to that population group. Then we have the exposure. So obviously social media could also be social networking. It could be a specific program app like Facebook or Instagram or Snapchat, or more importantly, TikTok these days. So again, there are things that we can search directly for. And then there's the outcome. So we are looking at eating disorders, but that can be in different forms. It could be anorexia, it could be bulimia, binge eating, it can relate to body image, and so on. And then below that, we have the source terms. So as well as searching or identifying the keyword search terms and then running a search, whether it's an unqualified search across all fields, or whether you're searching within a title and abstract field, we also want to complement that with the use of the APA Thesaurus. So we've got adolescent attitudes, adolescent behavior, for example, youth mental health. We've also got, for exposure, social media, digital marketing, for example, and also could factor in cyberbullying as well. So these terms I've identified, obviously, as you can probably gather from previous searches. So we may not know what the definitive APA Thesaurus term is up front. We may discover that through our searching. We may do something of a scoping exercise initially, and then begin to refine it so that we can create a more viable search strategy that you can run on this database to retrieve records that are out there that are indexed in APA PsycInfo. And then for the outcome, of course, again, in italics and uppercase characters, we've got eating disorders, eating behavior, anorexia nervosa. You'd expect these would be APA Thesaurus terms, given the nature of this database, binge eating disorder, binge eating, etc. Okay, so this is not an exhaustive list. This is just to really illustrate the process of breaking down, that research question into the three key elements, and then identifying the various synonyms that we should be searching for when we create that search strategy. So before we do that, I just want to mention a few other things before we go to the live site again. The first of which is the source of psychological index terms, the APA Thesaurus, which is updated. I believe it's quarterly these days. I could be wrong, but I think it's quarterly. So this is some examples where new terms have been added. As you can appreciate, over time, society changes, things that would once be acceptable are not acceptable anymore. Obviously, there may be new conditions, new situations that are identified as society changes. So you've got things like attachment security, child custody evaluation, new terms added to the thesaurus by the APA to reflect the content that's being added to the database. So you can find more information on the APA website. They do have, I believe, a PDF copy of this, that's available that will give you more information on the thesaurus, how it's created, etc. In terms of accessing that information, as we saw on the landing page, you have the subjects tab that's available, as you see highlighted here. And that allows you then to browse the thesaurus for a given term like eating disorders. So you can browse for eating disorders. Sometimes there's not a direct match to your term, but in this case there is, of course, as you might expect. And once you've identified the term and selected it, you can add it to the search. That will then be added to the search box, and you can run the search for any item indexed with eating disorders and related terms. So there's a plus sign in this example, which indicates that this term can also include additional narrow terms. And we'll see that live in a moment, how that works in practice. Also to mention, before we go on to back to the live demonstration, we do have a variety of filters available. These are specific to APA Thesaurus, to the APA PsycInfo database. So the subject major heading, that relates to the APA Thesaurus term. That's where it's the primary focus of any indexed article. Assign that heading. We have the classification. So this is the internal APA PsycInfo categories or codes to describe the content. There's the methodology, which could be important if you are looking at the type of study that is reflected in the results. So it could be a clinical case study, it could be a systematic review, it could be a meta-analysis, qualitative study, for example. So you can select from the available filter. Tests and measures, this would include published and unpublished tests and measures that are mentioned in the source document, and also whether it is appended to the source document, which it may well be. And then there's the population. Again, this is a standard description of specific populations related to the content of the document. Now, for those who want more information about the methodology limiter, we do have an FAQ, a frequent asked question, on EBSCO Connect, and I've included the link in this PowerPoint as well. So you'll have a copy of that post-session to explore further. Okay, so that's just kind of the background element I wanted to share in terms of this database specifically. I know there's some of you want to learn more about the interface features, and we'll see some of the functionality as we go through the live demonstration. So let me now move on to this demo as we work through this particular query. So let me share my screen and we'll go back to the interface. So we're going to start with the aspect of course, young people. So again, we can add multiple terms here. We can use various elements to help us find those terms, for example, with truncation. So if we did a search for adolescents, for example, we can truncate it in this fashion. Okay, so that would be all versions of adolescents. Okay, and then we can add, for example, youth. If we want to use teenagers also, we can truncate teenage to find, so teen, that would be teen, teens, teenager, teenagers, etc. And we can also use quotation marks for exact phrase searching. So for example, we can use young people here. So give you some examples of what we can search for. Let's see what else. Young people. I think that suffice for now. What I'll also do here, I will make this a qualified search. So what I'll do, I will select from the drop down XB here. So that's the title or abstract search in the APA PsycInfo. So we're going to search for a combination of terms. The term here combined with this search here. So when I run the search here, what you should see in a moment is the search history. So that's collapsed or hidden by default. So this is a relatively new feature. It was added or implemented about a few weeks ago, and some of you may have already seen this in other sessions, or it may be new to you. But if you click the arrow now, you'll see the search history. Now at the moment, it's given me also the sets that we ran earlier on natural language search. So what I can do here, I can delete these. Now we are going to introduce a bulk delete to search history coming. That can be done in other areas of this interface. So what I'll need to do here is just delete these line by line at the moment. So the ability to bulk delete is coming soon. Okay, so we're just waiting on that, as it were. But I can just remove these because they don't really, and I'm not sure what happened there. Try that again. Let's go back again. Let's just go back here. Okay, and then so we're going to delete this one. Okay, and then so what we're seeing here now, once that's gone, is the new search. Okay, so we've done our title abstract search for the particular population group, but now we want to look at the equivalent subject terms for that group, that age group. So to do that, we can use the subject's authority. So as well as accessing subjects from the landing page, the default advanced search page, we can also access it under research tools. You'll see subject's authority on the left-hand column. So if I click subject's authority here, I can clear this menu. I'm just going to clear these fields here, and I can browse the thesaurus for the equivalent terms. So I can add, for example, adolescent, okay, and I can, search for this term, okay. Now, if I don't find it initially, you'll see there's mention of this. I can also check the term begins with, okay. And now you can see here we've got a list of terms, and I can select these, okay, line by line. As you can see here, I can just select the tick boxes that relate to these terms. I can also select this one here, youth mental health. And if I want to explore any of these terms, I can click on, for example, youth mental health here, and you can see it gives me the scope note detailing what it's about, what it's used for. So if you did search for young adult mental health, you would ideally pick this term, okay? And then you can look at other terms here. And for example, it now gives us the main term which we've selected broader terms, which is probably too broad, mental health, but also importantly, related terms. So I already selected these two previously. I can go in and select the others as well. Okay, so you can see I can select those also. For example, there's also youth services, which maybe I can use that as well. So I can select all the terms, the main term, broad term if appropriate, and then the related terms from here. And then I can click add to search. And then you'll see the complete set of subject terms, the APA Thesaurus terms are indicated in this database. So you'll notice for each of these, we have the DE field code. So that's descriptor, which is also reflected in the drop-down menu. So you see it's an exact subject heading in the APA Thesaurus. So these are the definitive terms for identifying this subject matter. So I can run a search here for this. Okay, and what you'll see here, it's now added it to the search history. So the rows above are still on the screen. We've got the search history displayed as open, and we've got our results below so far. So with this, we can collapse this, or we can not collapse this, we won't do it now. We can combine the two sets. So this is the first of the three PEO elements, the population element, young people. So what I can do here, I can select these two sets, and I can combine with OR here. Okay, because essentially we're dealing with the same population group, but where those terms appear in the title or abstract, plus where those index terms have been assigned to articles which are about young people, essentially. So I can click search here. And once I do that, it's going to combine it into another set, S3, and you can see the results indicated. Now, this is only the first element. We are going to repeat this 2 more times, but with different aspects of this subject. So the next thing we're looking at is social media. Okay, so, or actually we should be looking at, yes, social media, and then we'll look at eating disorders as the outcome. So the exposure is social media. So we're going to do that again. We'll run the search. We'll put social media in quotation marks, or social networking, for example, and I can truncate social networking too. Okay, I can truncate this to social networks or networking. I can add, for example, let's see, cyberbullying as well. Okay, I can put that as bully or bullying, so it's truncated. I can also put it in quotation marks for any instances where this is mentioned as a phrase, if you like. What else? And then we've got the likes of, let's go for, or TikTok, or Instagram, or Snapchat, okay, or possibly Facebook, although that's not really considered, I guess it's not so much popular among young people these days as it's older people, as it were. And there may be others out there that you would certainly want to add to that list, okay, but just to illustrate here. And so, and also we want to add digital media as well, just in case that also would bring up results that might be of value to us. Okay, so we use those terms. And again, we can form a title and abstract search or abstract search here using the XB field code there from the drop-down menu. And then we can check this and search. Now, before I go any further, if you do spot errors, I mean, you may spot errors that I make, of course, please let me know. But if you yourself are using the interface and you make an error, or maybe you think I should add another term, then you can go in, for example, go to the tools menu, adjacent to each set number, each line, and click edit search details. Click edit search again. It will take you back to the interface and you can add something more. So I'm just thinking if there's anything else I didn't add that I could add that I identified previously. I mean, I could add, for example, I could add or multimedia. Let's just add this one in. Okay, it's probably a bit too broad probably, but I can just add alt multimedia. So I can update the search, click continue, remove this, and then what you'll see is that's updated in the search history. So now S4, which is the set we ended up with, I've now edited this to put multimedia. So I can edit each line in turn. So whether you make a mistake, it could be a typo, or you want to add another term or change truncation or quotation marks, etc., then you can do that line by line now in the search history. So we want to obviously search now for the subsequent related APA Thesaurus term for social media. So we can go back to subject's authority. I'll clear this, and then we'll search for social media. Okay. Hit search, and you can see we've got these terms here. So we've got social media and the plus sign indicates that has narrow terms that would also be selected when you select the explode option. Now, if you want to know what they are, just click on the link itself, gives you the scope note. You can see that this term was introduced in 2012, so obviously a recent phenomenon, as it were. You can select social media now, and when you do that, notice the narrow terms, online social networks and social media influences are automatically selected as they are according to the explode option. Now we have others here. For example, digital media, we could still select that. And then we've got others like cyberbullying, cyber sex there, digital marketing, maybe not. We could be very broad, internet, etc. Online community, possibly. Social media use, obviously. So, yeah, so there are a number of things that we could be using. Some of these are very broad, some of these are less so. But we can select those terms. And again, if we scroll up, click add to search, all those terms are now included. Okay. So again, you can see them clearly identified with the DE field code prefixing them as well. So we can then click search here. So once again, we're looking to combine the two sets together. So this is the exposure element of this PEO search. So we can do that now. So let me just check if there's any questions or comments so far. None. Okay, so I'm going to select S4, S5. Now I'm still handling the search history in the order that's presented to me, which is the reverse chronological order. So you are seeing the most recent result sets displayed at the top. You can resort it to display the sequence, which I'll do in a moment. So, and that would be particularly important for systematic reviews. Obviously, you want to report on what you've done, the sequence, etc., the logic of it all, and I prefer to see it in sequence myself. So you can see the two sets there, and then use the OR operator combined with OR, and that is placed in the top search box. And I think I maybe just check here. Yeah, unfortunately, it's what's happening here is I'm using an APA profile which features multiple databases. So I'm bringing back databases here. So I might have to change this in a moment. So I'll come back to that, but I'll just run this for now. So obviously you can run these searches across multiple databases, especially where they share the same thesaurus, etc., thesauri, and the same syntax. But generally speaking, you probably will be doing this individually as I intended on the APA PsycInfo database specifically. So what I'll do here is, let's see, we've got the S6, which is the social media element of this search. And the final thing that we're looking at is, of course, the eating disorders. And I'll just stay where we are right now, just for sake of time. So for that, I'll again look at eating disorders as a, let's see, as a phrase. Okay, eating disorder or disorders, it could be disorder or disorders, either way. Let's see, anorexia, and I could truncate anorexia for anorexia nervosa, for example, or anorexic and anorexia nervosa. So that's anorexia, sorry, or anorexic, or bulimia and bulimic. So again, I can truncate these, okay. And then also binge eating could be eating or binge drinking. Now I could change this also in other ways, but for the sake of time, I'll just put these as phrase searches for now. Binge drinking, okay. So, and I could add purge, for example, or body image is another one, I think. That's right, and or purging. I'll truncate purging for purge. Okay, so I just leave it as that for now, and again run this as a title abstract search. Now, what I might need to do here at this stage, I might need to just go back here and just deselect these ones, because the title abstract search, by the way, doesn't run across multiple databases. It will run only on an individual database. So I'm going to change this. I may need to delete one of these sets in a moment, but let's see now. So what it's done here, if you just look here, S7 is APA PsycInfo, whereas S6 is multiple databases. So obviously I switched to multiple databases, which I didn't want to do. So what I can do here, it's a good illustration. I can delete this set as well, by the way. I can go in here and delete this. And you get a check, just do you want to delete this? And I'll say, of course I do. Yes, delete. And it will renumber the set numbers, by the way. So you can remove sets from the search strategy as needed, especially in that kind of context, that situation. I'm just looking at others now. If we've got, this one also. Let's see. I'm going to see how many. Yeah, the others are okay because they're all APA PsycInfo, but this one, of course, has been running across these databases. So I'm going to see if I can just go in and edit this one. Let's see now. I haven't tried this part before, but I'm going to go edit here. So it won't let me edit the search there. Okay. So you can see here, it's selected multiple sets there. So what I'm going to do here, I'm going to cancel this one. Okay, I'll just move out of this one. Okay. So what I might need to do is just come back here. So this is the data. Yes, this is the one I wanted to remove actually. What I might do is just go in. Let's see, I might actually copy this. So if I go in and edit search details, okay, what I'm going to do is copy this particular search. So I copy it to the clipboard just to save time here. Okay, I am going to delete this one again. Okay, just so we can go back to where we were before originally and then run the other two search, and then I'll delete this one. Okay, so you can see it's very easy to delete sets when you don't need them or they're redundant. And I'm going to just paste this in and run this one, but this time I'll make sure that I want APA PsycInfo. I'm just using a demonstration site which has multiple databases selected up front, as it were. So now I'm going to look at this one. Let's see now, where are we? Social media. So let me just delete this. So we've got, okay, the first two, which is fine, social media, and then we were going to run this set here. So I'm going to run this one. Okay, so we should now be back on APA PsycInfo. That's fine. So we're back on track. Select both sets here, combine with OR, and we are using APA PsycInfo. That's selected. That's fine. Okay, right. So we're back on track here, and that should be the right the right set. And now we just do the final set, which we are in the right database. So we'll put in eating disorders again. So actually, what I might do here, I'm going to do something here, eating N2, so that's near 2 words or less of disorders, and I'll truncate this. So I'm actually introducing a proximity search here. So that would be eating disorders or disorders of eating or disordered eating, as it were. So I just decided to add that in. I've also got binge anorexic again, or bulimia, just to save time. Okay, or binge eating, or binge drinking. Okay, as phrase searches. And then I'll add one more, just for the sake of time, purging. Okay, add body image. I did have that in there before. Again, I can go in and edit these search strings if I need to. So I'm now going to do a didactic search here for this element. There it is, and then search here. And the final set will be, of course, the equivalent subject search. So again, I want to make sure that I'm still in APA PsycInfo, which I am. Go to subject's authority, clear this, and then search for eating disorders. And then we can select this term again. We can explore it further if we wanted to. So you can see it's used for appetite disorders and was introduced in 1997. So you can select the main term. Once you do that, the explode is there selected automatically, and you can see the narrow terms which are already selected. And of course, the broader term, too broad already, mental disorders, but we are looking at anything related to eating disorders, so binge eating behavior possibly, emotional eating, food addiction, let's see, nausea, let's see, anything else, probably leave it there. So we've got all those terms selected simultaneously. So we'll click add to search. Again, you'll see the complete set of subject terms are detailed in the search box, and we click search here. Okay, and then we can combine those two sets, S7, S8, and with OR. So we are still in the same database, which is what we intended to do, and click search once that. So Oliver's asked a question, good question. Is there no need for quotation marks in the proximity search? A good question. It depends on how it's being configured. So some institutions have configured proximity search to search as an exact phrase. So for example, they use the W within 0 precision operator. That means within, basically next to each other in the order that you enter them. So the NHS in England have configured the platform to use proximity search in that way. So they designate that proximity as a phrase search. So again, it depends on how it's been configured behind the scenes. And then David has asked, can you demo exporting search results? Yes, I will. I just keep an eye on the time, but I plan to show you exporting. So the quotation marks are really the main way to perform an exact phrase search within the platform. However, the proximity search mode can be reconfigured as a phrase search. Okay, so we got the three sets, and as I said, I will resort these now in the sequence. So if I go to ID, just above the set number, within the search history, you can see now the sequence. Okay, so this is much more logical. So I can combine the adolescent group, population group, the P element, which is set 3, with the social media, this is the exposure, S6, and combine it with the outcome, eating disorders, S9. So it's a combination of title or abstract searching with the APA Thesaurus terms in PsycInfo. So make sure that there's nothing appearing in the search box. So I can then combine with and. You'll see the combined query appearing in the top search box, and then I can run the search and click search here. Now I've done variations of this, so I may end up with less or fewer, more or less than I had before, but we'll see. Okay, so we scroll down, and you see we've got over 500 records here, which is a good number. Now, you could leave it as this, of course, and just to also highlight in the search history, we've got the set number, of course. You can select the individual set numbers there, of course. You have the means to download the set, by the way, the search, by the way. If you select these sets, you can see there's a download option. It takes the complete search string there with the subqueries, and you have a choice: PDF, Word, CSV, if you want a table in table format, RTF as well. So if I select RTF here and click download, this is the search itself, of course, not the results specifically, but the search strategy. Then I can just drag this across from my other monitor, and you'll see the search history. So this is the search history taken from that live search, and you'll see it gives you each set number with the query, etc., when it was run, the time, the results retrieved, the search mode, etc., the interface, the database. So again, each of these represents each of those search sets, those lines that you saw in the search history live. Okay, now I haven't filtered yet, but it would also include the filters as well. So if you want a document detailing the search, this is one way to do it. This is the rich text format, which collates it nicely. Word tends to put each set on another page, by the way, at the moment, but you have got the CSV form as well, option format, to see a table of those results if you prefer. So again, that's the option there you can download from this search history. Also, the search options are given as well, what's being applied or could in theory be applied. Typically, if you're using obviously subject fields, apply subjects is not going to be applicable because you are already going to the index term. So again, likewise, by proximity would be bypassed, but proximity would still come into play for these other searches. And then you have the search results, the number, the hit count, and then as we saw, the database is listed. And for each of these lines, you have tools to edit the search. You can add it to a project. I'll say more about that later, or you can delete a line as I did earlier with the sets that I had. Okay. So let me just move on here. So we've got these options to filter. You've got the initial filter. So link full text indicates any full text, whether it's open access, coming through a link resolver like LibKey from Third Iron, or the EBSCO full text finder link resolver. Again, full text content, because APA PsycInfo, as you can appreciate, is a bibliographic database. It doesn't include full text directly. However, through various subscriptions you have, whether national, local, regional, you can have full text, obviously available through a link resolver, for example, or with EBSCO smart linking, which transfers full text links from some database like Medline and CINAHL, where full text is available, to APA PsycInfo. So also, for those of you working in the NHS, Psychology Behavioral Sciences Collection is a full text database. If those articles are also indexed in APA PsycInfo, you will find the full text content available here as well through link full text, through smart linking. Peer reviewed, majority is peer reviewed all time. Again, you can filter, for example, if you're looking at the last 10 years, rather than beyond that, you can filter accordingly from this page. and also source types. Again, if you're looking mainly at academic journals, then you can filter here, apply that filter. But it may be that you're specifically interested in the population group, as we've been focusing on adolescents. So with all filters, this will open up and expand another column. You can see also English language here as well, although we do have translation features, especially for online full text available. And you can see we've got age here as well. So again, adolescents specifically we're looking at. Young adulthood, we're really focusing on adolescents, this age group. You could extend it a bit further if you wish to. Gender also here. But we also have the classification scheme from within APA PsycInfo. And we also have the methodology. So you may be looking for a particular type of study. For example, it could be an empirical study that you're looking for, so you can filter accordingly there as well. And then tests and measures and population, again, is also indicated. So it could be inpatient or outpatient, for example. So if we just leave it as it is right now with those filters applied, you'll see they'll be also would reduce the number of results displayed. And notice in the search history, each of those filters is also recorded. So you have a record of this when you download the search as well. Now, as was mentioned, what if you want to export the results? You may want to go in and save records. You may, if you have more time, and look at them individually. But at this juncture, you may want to just export them. So you can do that with the option above the result in the result page. You can select these, and then you can see there is the option to export results up to 25,000. Now, it doesn't have to be anywhere near that figure. We've got 218 results. You can save currently 50 records per page. That may change in due course. That is being looked at. It's possible that will be enhanced to increase that figure, which I know we've been asked about before. But if I want to export, I can click on this link here. And now it does ask you to sign into EBSCO. So this is your personal folder account or your personal account to use the platform, as it were. So you would authenticate in the normal fashion through Open Athens, for example, or Shibboleth. However, if you want to use the export feature, if you're outside the NHS in England, which has single sign-on, which synchronizes with the folder when you log in with Open Athens, you will need to sign in here. And for that, you'll need to either create an account if you don't have one already to fill in this form. We do support Google Sign In as well. Enter the details here and agree to the consent form. So you can use it immediately. You've created the EBSCO account. You then sign in, enter your details here. Okay, and now it's giving me this export form. So once you sign into EBSCO, it does give you the option to email a link to the metadata. Okay, now you'll see the number of results that can be exported at one time is 25,000. But there's an upper limit of 100,000 in a 24-hour period. So if you have more than 25,000, it's still possible to export the additional 1,000 or so records later on in the same day. Okay. Notice we also support XML, CSV, BibTeX, and RS format for the export. So if you select, for example, RS, you get confirmation on the screen that a link to download the metadata for your results will be sent to your inbox, and then you have 7 days to access that link. So it's live for 7 days essentially, and then you can extract that information and import into your preferred software. So if you're using RefWorks, EndNote, etc. Okay, so you can export directly from the result list. You've got other options here too. So for example, you can set these records. Again, you can select these 1 to 50 here. You can download the list, so the metadata only. So Word format is also supported, as is BibTeX, CSV. You can download that list. You can save them also. And when you save records from this list, they are saved in the save folder under My Dashboard. If I click on that link now, you'll see the records that are saved. Now, this is collating it with other records I've saved previously. So again, it's just keeping the list there. And if I go back to my search, okay, I can also add these to a project. So the difference between the save folder project, saved is by default, is like your default folder for saving searches, results, etc. A project folder is more personalized. So in other words, if you're running a series of searches for users, supporting colleagues, then you can create your own personal folders, subfolders to store items. So searches and the the subsequent records you retrieve in the same folder. So for example, if I select these records here and go to add to project, again, this requires that you're signed into my EBSCO. You are then given the choice, and I've got a variety of projects I've created recently, but I can add a new project here. So again, this is on eating social media, and I've done something similar before. So I use this one as my name. If it's a particular search that you're performing for a user, then you have a deadline, then you can assign a date here to remind you when this needs to be sent through or completed. And then you can add a description, maybe it's for a department or a, psychiatrist, consultant, etc., and create that. So you'll see confirmation on screen. It's been saved to a project. If you go to the projects on the left now, under my dashboard, you'll see I've got a series of projects, and I've got this one now, social media and eating disorders. Now you can delete any of these. So for example, in this one, I can go in and delete from here. So we now have the bulk delete option. You can delete a variety of projects there. You can go into the project and you can view the articles. Okay, so you can review them in your own time, and you can also download them from here, and you can also export them from here. So you can export this list into RIS format, RefWorks, EndNote, etc. from this menu, and you can delete when they're no longer required. Now, if we go back as well, so there's projects again, you'll notice here, for those of you not migrated, or if you have, you can get a report from your previously saved custom folders. So when you migrate to the new platform, anything you saved in the original MyEBSCO folder is transferred across. However, if you create your own custom folder within MyEBSCO with the classic interface, that will not be migrated directly, but you can get the report and you can download the report, which is a table in CSV format of the records you've saved and according to the folders that you've created. So you just click download report, okay, for that. That's currently available to the end of December, but I believe that will be extended. I'm still awaiting a response on that. I think it's yeah. So that's the official date when that functionality is not available, essentially. Okay, so that's the folder. I'm just going to go back to the search again, and just as we begin to get near the close here, just a few more things to point out here. So we have the export option here. Again, you can see that. So if you any couple of records, you can export, share. Sorry. So email, you can email the references, send it via email there, or you can save it to Google Drive or OneDrive if you prefer. So the share option is also there. The site tool is also here as well. So you've got APA 7th edition selected here. You can switch to another preferred style if necessary, or you can copy that to the clipboard. So when you export the citation, it'll be exported into that reference style. Okay. You can go into any one of these records. If we go to this one, for example, before we do, notice this is a brief format that you see on screen. If you want to view the entire abstract, click Show More for each of these abstracts. Likewise, if you want to view the other subheadings, the APA Thesaurus terms, you need to expand those fields, also with the authors as well. Okay, so again, these fields are somewhat hidden to avoid cluttering the screen. There is a setting in EBSCO Experience Manager which allows you to view the full abstract up front if you prefer. That is something that needs to be configured behind the scenes, but it can be done. So you've got tools for each of these references as well. Again, you can cite, add to a project, share, download there, and so on. But what I will do is obviously mention the save search option. So you can save the search here. So click Save Search. It generates this form and it does default to the final query. So you can change that. So again, we'll put it social media and eating disorders. You have the combined query here, as you see, with all those terms. You can copy that to the clipboard. Otherwise, just scroll down and it includes the subqueries and save it. So when you save a search, it just goes to the save folder. And on here, you'll see in the second tab, searches, it's listed here. So you can add that to the project you created previously. So just go to the Tools menu, Add to Project, select the project, and Add Now. So you can collate the search results and the search itself in your project folder. So again, it allows you to differentiate different search results. And you can see this one has the due date that I specified earlier. So you can click through to the project. The first tab is the records tab. So the save records, the download records, and then the searches that's listed here. And that can also be deleted from here if necessary. Or you can go in and check the search details. Okay. Anything we've been doing so far has been recorded in the recent activity as well. So that includes the search history. So you can see that there as well displayed, and that can be resorted in the sequence we started with, as you can see there. That's also shown there, and that also can be downloaded, added to a project, or deleted here as well. And any viewed records also be recorded here. Okay. Now I'm just going to check now. I know we're due to finish now, so I just wanted to check if there's anything else I needed to show you before I finish. Probably I'll need to jump back in a moment to the PowerPoint to wrap up. So let's see now. Let me just come back here and out of here. Okay. So that is really, I mean, that's the process essentially, and obviously we do have full text available. Notice there's also a cited by count as well. Now this is the new feature, so you can see this article here, item 1, has been cited by 215 articles, and you can view what those are on the column on the right there, and you can sort these as well by the most recent publication, and you can save those as well. Some of these are not included in your database, but some will be, and you can view more results there. Okay, so that's a new feature, and I won't go there now because of time, but you've got the access options. So PDF, online, full text. So again, these will be coming from another database, another EBSCOhost database, etc. Okay, so again, you can filter by the link full text as well, and you can hide the search history as well. So just to point out, you've got the online help menu on the left, so you can click on that link and that'll take you to the quick start guide, and this gives you the tutorial to the new interface plus the various elements of searching, browsing, using the dashboard, using tools, etc. So they're all included here. So again, you might want to refer to that in your own time, but that's linked from within the database itself. So I'm going to just go back now to the PowerPoint, as I know we're near to ending the session. We did start a little late, but what I'll do now is just go back to the PowerPoint. Lucinda, yes, will bulk delete be available in the saved items? So I'm going to check this now. I think it will be available in saved items. So again, you will see a bulk delete feature for the search history. As we saw in the result list, there will be one for that. You can also create citations in the APA style. And also, just to reassure you, we've got the platform roadmap. So again, for future developments with the interface, and there's more to come, we have this roadmap which is updated quarterly and often more frequently than that, and we have the research platforms link there that will take you to the page where you can view the changes, etc., and you can filter to EBSCOhost specifically. Okay, for those of you who are outside the NHS in England, you have the EBSCO Connect portal, which is where you'll find the majority of tutorials, help sheets, promotional materials, etc. And in addition to that, you have the case management system. So if you sign in to use EBSCO Connect, if you request an account for that, then you can create cases if there's any technical issues or queries that you have. Okay, these will go directly to our support team. So if you are part of a team of librarians and you have equal admin rights, if you like, or management of the services, then you can each register your own account, and then you would see the case that are reported by colleagues as well. So there won't be the duplication. Okay, so again, there's more information that we can send to you on that. And there are these links here about the interface itself, plus specific links about the APA Thesaurus that you might want to refer to, especially with recent developments, enhancements to it. And I would also recommend going to the APA website, apa.org. That will give you more information about the database itself, including the APA Thesaurus, etc., and the background to the database. So if you're interested to explore that further, again, they cover also a variety of platforms, but we are looking at EBSCOhost today. So I'm happy to stop there, take any last minute questions. If there are any, you can obviously contact me directly at rcrooks@ebsco.com. Okay, so happy to conclude there, and do appreciate your time today. Thank you very much.